This next discussion, we are going to talk about the epidemiology and burden of surgical emergencies in pediatric surgery. Okay, that's like a glance on how these issues is actually affecting the world at large. Okay, so for what we got here is, first of all, you should know that it carries a unique weight. Okay, because when these emergencies occur, the child could actually deteriorate so fast. So the window for you to intervene is very short. Do you understand? So if you delay, it could actually lead to damages that could actually be irreversible. So overview of neonatal surgical emergencies is you have things like intestinal obstructions, necrotizing enterocolitis, gastrochesis, okay, omphalocele, congenital diaphragmatic hernia. Okay, so the conditions, they have a high morbidity and mortality rate most of the times when you delay the treatment, when you delay the diagnosis. Then that's neonatal emergencies, right? Then infancy to early childhood emergencies, you have things like intussusception, acute appendicitis. Like, we're trying to classify the emergencies based on the different age groups you have in pediatrics. Then inguinal hernia with incarceration, malrotation with volvulus, all are frequent. Okay, then non-traumatic abdominal emergencies, they are usually high across the sub-Saharan Africa. Okay, and epidemiology is marked by predominant obstructive pathologies in infants and children. Then survival is tightly linked to timely presentation. So most of the times the parents actually present late with his children. Okay, so incidence and pattern of age distribution. The first 8,000 days of life, that's when you stand a risk of this. That's between age 0 to age 22. Okay, so there's a repeatable set of urgent, non-congenital, non-traumatic conditions across the developmental stages. A narrative synthesis highlights that many of these emergencies are preventable or treatable. So emergencies usually cluster in the neonatal period and infancy. If there's any delay in resuscitation, okay, usually affects the survivor, and sometimes can cause damages that can now go with the child for life. Okay, so people in low and middle income settings usually report higher rates of late presentation. Okay, emergencies could occur any place, but people that are actually living right, when they see an emergency, they present to the hospital. There's now like easy access to good hospital stuff and all of that. But for people living in low and middle income settings, they don't really even have good hospital facilities. They don't really have the good knowledge, so they could actually present late. So in sub-Saharan Africa, a last prospective cohort comparing 5 common pediatric surgical conditions found substantially worse outcomes versus high income benchmarks. Okay, that's to tell you that for places in low income, there's a worse outcome. So I think basically that's it. So each survivor may face chronic morbidity. Okay, that's to tell you that sometimes when they survive from these medical conditions, there's like future effects this could actually have on them. Do you understand? So you have long-term disabilities. So some people might actually need help for a very long time. Then the burden on the healthcare system is pre-hospital delays. So distance, referral friction, low caregivers awareness could lead to late arrivals in the facilities, especially for infants whose symptoms are going on so fast. The resource constraints in the hospitals is they could actually cause so much stress on the hospital. Do you understand? The hospital facilities and everything. There are workforce and training gaps. Many district and regional hospitals cannot provide definitive pediatric surgical care, so it usually overwhelms the facilities that could actually provide this surgical cares. So it's more referral for this. So He's just trying to talk about the epidemiology in Nigeria and West Africa. So infants compose a large share of presentations for non-traumatic abdominal emergencies. There's male predominance, okay, and nearly half present within the first 48 hours. Okay, so that's what we got, for the incidents. Just to give